Welcome to Unit 3, Lesson 1 of Principles of Health Science. Today, let's look at health insurance and economics and healthcare. So the first thing we need to look at are the types of healthcare models. And the first one is the Beveridge model. Now, the Beveridge model is found in the UK, and it is completely owned by the government. So, government funded. And then there is going to be the National Health Insurance model, and that is the Canadian model. And it is government funded, but the user pays after a point, which is the point of use, right? So let's write, but user pays, and this a little could be co-pays or anything like that. And then there are insurance systems like the Bismarck model, which is the Germany model. And the Bismarck model is employer gives the insurance. And this is done through payroll deductions on things called sick funds. And when someone gets sick, they use their payroll. But unlike the United States, the Bismarck model is theorized and its aim is to be non-profit. So decentralized private systems run for-profit or non-profit, and that is going to be the US with decentralized. Now, something that's unique about the US is that it has models that are present. It has a mix of models, okay? So Veteran Affairs is actually very similar to the Beveridge model, because the government is providing care. And then Medicare, which we'll talk more about, is a lot like the NHI model because it's providing 70-30 co-insurance for the elderly. So the government is paying 70%. And then there are things like employer insurance, which a lot of people have in the US, and that is going to be like the Bismarck or Germany. And then people who are uninsured will be the out-of-pocket model, which is the last model. And the out-of-pocket model is in a lot of countries that don't have stable healthcare systems because they are underdeveloped. So those are insurance models. And now let's look at how is the success of healthcare measured. Well, there are a couple measures of healthcare in the curriculum, and one of them is life expectancy and healthy life expectancy. So, and then there is infant mortality rate, or the number of infants that die before their first year of life. And you'll learn a lot about this if you are in the AP Human class. And then the cost per person. Okay, so do wealthy countries of the world have higher or lower life expectancy? Well, wealthy countries are going to be considered the MDCs, which this is basically AP Human, the more developed countries. And more developed countries tend to have better access to healthcare, most importantly, but also elderly healthcare and education and good lifestyle. And that leads to higher life expectancy in most of the wealthy countries of the world. And then infant mortality rates. Something that is really scary is that the US has infant mortality rates that are the highest of wealthy countries and has very little decline in how high this is in the last 10 years. So US has highest among wealthy countries. And something about the US is also that the US cost per person has the double the average person in the rest of the world, because the US makes people pay their own stuff and it's privatized, so it's not regulated by the government. And a lot of times insurance companies and stuff will cost so much for random things. So people in the US pay 2x per person. Or the cost per person, so double. And something important that we didn't talk about is that all wealthy countries in the world, other than the US, have a form of universal health care. And that is making sure that everybody is covered. So all health care other than the US. So the US doesn't. And the United States is the only wealthy country in the world that does not consider healthcare a right. So let's make a list of what the US does. So highest infant mortality rate, highest cost per person, and no universal health care. The US doesn't consider health care not a right. And 25 million Americans, or 18% of the population, are currently without insurance. And that might have changed now, but 18. Now, healthcare services fall into different categories, and there are 3 types of healthcare services, and let's list them out. So the first type of healthcare service is primary care. Now, primary care is the least expensive, and it is in the form of preventative care. And this is usually just your general practitioners, family medicine doctors, and pediatricians, dentists, and it's all about preventing issues. And the most successful healthcare systems focus on this. So this equals success. Now, the second form of healthcare, the second form of care that's offered is secondary care. Now, this is slightly more expensive, so the cost is going to go up. And it's specialists. So if you see a cardiologist, it's going to be this. And they don't have continuous contact with patients, but they address complex issues. So somewhat complex care. And then we have the tertiary care. Now, the tertiary care is going to be very, very specialized. And this is going to be the most expensive kind of care. And it's going to be things like the ER and surgery, therapies, long-term care. And this is the most expensive healthcare. Successful healthcare systems focus on the least expensive form of healthcare, like the primary care, and prevent the cost of tertiary care. So healthcare systems that are successful use this the least. To pay for healthcare in the US, people rely on health insurance plans, and there are thousands of companies that offer health insurance plans. Let's do plans, right? And there are a few terms that come with health insurance plans that we should understand. Individuals are responsible for paying a monthly premium or fee for their coverage. So a premium is a monthly amount you're paying for coverage. Monthly fee. Now, a deductible is the amount that you must pay for medical services before the policy begins to pay. So if you have to pay 30% of your coinsurance, the 30% in dollars would be your deductible. Now, if you get a really, really terrible disease and your deductible is let's say $1,000, then you only have to pay $1,000 even if your care ends up being super duper expensive. Now there is co-insurance. Now I've been saying that a lot, but co-insurance is not two insurances. That does not make sense. Co-insurance is the percent of the care that you have to pay for. So if you have a 30-70 plan, you pay 30%, insurance pays 70%. This is the co-insurance. This part is co-insurance. And a co-payment is what you pay for your care each time. So if you go in and you get a thing, if you get a physical done and you go in for a sick visit or something like that, and you have to pay your doctor $40 to get your care, then that's a co-payment. That's what you're paying each time. The co-payments are often seen too in the pharmacy. When you pick up medicine, you might have to pay like $10. And then there are other types of plans called the HMO and PPO. So HMO is the Health Maintenance Organization, and this is a health insurance plan. So let's go on to another slide. Now let's look at the two types of health plans in the US. There is the Health Maintenance Organizations and the Preferred Provider Organization. Now, the Health Maintenance Organization is the HMO plans, and these plans are managed by, are like strictly managed. And this is if you only go to, for example, Kelsey-Seybold, only go to one hospital. And the goal of this managed healthcare, so the most important thing is that it is managed. And the goal of managed healthcare is that the patient, all care given to this patient has a purpose. So care and it requires a patient to have a PCP or primary care physician. And this primary care physician has to make the referrals to specialists. If they don't have the primary care physician make the referrals, they have to find them themselves. and they have to be HMO affiliated care providers, or they're going to have to pay out of pocket, and it's going to be super expensive. So the PCP has to make referrals. And it has to be HMO affiliated care. Now, another type is going to be the preferred provider organization. Now, the HMO is not super expensive, but the PPO is going to be more expensive, and that's because the preferred provider gives a lot more patient-focused choosing, and it requires the patients to pay a deductible and copays. And they may also limit the insured to choosing affiliated providers, but they don't always. It's still going to be out of pocket if they don't, so they want to pick PPO people. And both HMO and PPO require monthly premiums for participation, and individuals, companies, or both pay these premiums. So they both require monthly fee. Both have premiums, but the HMO is going to be lower premium than the PPO. And they're able to see specialists without PCP referrals. So they can see people who are associated with PPO, but they can see without a referral. Now, there are government insurance plans, and these are like Medicare. Medicare is a program for people who are 65 and older, and it provides care for people with disabilities, any person with end-of-stage disease, and Medicare consists of 3 types of coverage. So let's write Medicare. 65 and older, and there are 3 parts. So part A is going to be your hospitals, services, and hospice. And hospice is end-of-life care. So if somebody is destined to pass, then they might be put on hospice. And then part B is going to be doctor services and labs. So the doc and labs. And part D is going to be pharmacy. So this is going to be medications. Now, the individual pays a premium and deductible for Part B services, and Medicare only covers 80% of services, and the individual must pay a balance or carry out additional insurance. So Part B is going to be doctor visits and labs, and this is when they pay their deductible and they have premium. And Medicare only covers 80% of care. And the other insurance that people get to cover the 20% is called gap insurance. Now, you don't need to get it, you can pay out of pocket, but 20% is gap. Now there is medical care that is provided by the government that is called Medicaid. Now, what is the difference? Well, your teacher is going to tell you that you care for the elderly, and you aid the poor. So the Medicaid is for people who have low income, and it's jointly funded by federal and state. So US/state funding. And it's for the poor or low income. And Medicaids pay for hospital visits, physician care, long-term services, and also offers dental care, eye care, and other things. So they have eye/teeth too, which oftentimes people have to get their own insurance for if they're not being covered by the government. Now, there are even more types of government-provided care, but this one that we'll cover is called CHIP. Now, this is the Children's Health Insurance Program, and CHIP is for kids, but it's for uninsured children of working families who earn too little to afford healthcare, but too much for Medicaid. And one of the highest providers for CHIP is Texas Children. So this is for kids and families. So for normal healthcare. And it provides inpatient and outpatient, well baby and well children, including immunizations. So vaccines are covered too. Now there is workers' compensation, which is health insurance plan that provides treatment for workers injured on the job, and it's administered by the state, and payments are made by the employer and the state, and the plan reimburses for workers because of wage loss due to injury on the job. So if they lose income because they have an injury, well, they provide reimbursements for that. Now, claiming workers' compensation can become very, very hard, and it can become insurance fraud if you have an injury there, but you can't really prove that the job caused it. So that is really hard to get. But there is healthcare legislation that we have to look at. Now, this is going to always start with HIPAA, because HIPAA is a big part of economics in healthcare. It is 2 A's, and it stands for Health Insurance Portability and Accountability Act, and it was done in 1994. Now, HIPAA regulations change the way medical information is processed and managed, and it resulted in a reduction in administrative costs, increased tax benefits, and decreased fraud and abuse to help reduce healthcare costs for everyone. So because HIPAA made sharing information different, it benefited by reducing pressure on the system and reducing costs. So that is important to write. And then President Obama healthcare reforms in 2010. Let's do a quick summary of that. So this is called Obamacare. And it covers all Americans with health insurance by requiring employers to provide insurance to their employees and mandating all children have insurance. So it almost created a universal health care for the US, but children, and we'll put a star for required, and employers have to give to employees. Are required to give to employees. And they allow workers to keep employer-provided insurance if they lose their job or are in between searching for a job. So this was a big flaw of the Bismarck system, because when people lose jobs in Germany, they don't have insurance and they are unemployed. And that's when people tend to need insurance a lot, because we can see that with COVID when a lot of people lost their jobs, but they have health problems. So this allowed people who lose job to still have care. And they outlawed the practice of insurance rejecting people from pre-existing conditions and made insurance premiums the same for everybody regardless of health status. Now, this is debated upon whether it's fair or not, because it raised insurance premiums for everyone. Because pre-existing conditions are thrown into the pool and everybody's having to pay for these people with pre-existing conditions. Even those with pre-existing conditions. Now, this also helped people with pre-existing conditions, though, because a lot of times insurance can deny pre-existing condition people the policy, or they can make it super duper duper expensive, and that is not fair. So that aimed to help those people. And then it provided a one-stop marketplace called the National Health Insurance Exchange for customers to compare and shop for plans. So the National Health Insurance Exchange became a marketplace. So a government-run public health insurance option to provide low-cost, affordable health care for everyone, spur competition. So it spread competition among the people who are arguing not to, and for insurance companies for which is the best. So that is insurance, and make sure you look at your vocabulary because that's what's going to be quizzed the most.